Hey, it's time for an apple fritter. Here's your host, Jimmy Apple.
Welcome to another episode of An Apple a Day's The Fritter. I'm your host, Jimmy Apple. What is diabetes? Diabetes is a disease that occurs when your blood glucose, also known as blood sugar, is too high. Blood glucose is your main source of energy and comes from food you eat. Insulin, a hormone made by your pancreas, helps glucose from your food get into your cells to be used for energy. Sometimes your body doesn't make enough or any insulin, or doesn't use the insulin well. Glucose then stays in your blood and doesn't reach your cells. Over time, having too much glucose in your blood can cause health problems. Although diabetes has no cure, you can take steps to manage your diabetes and stay healthy. Sometimes people call diabetes a touch of sugar or borderline diabetes. These terms suggest that someone doesn't really have diabetes or has a less serious case, but every case of diabetes is serious. What are different types of diabetes? The most common types of diabetes are type 1, type 2, and gestational diabetes. If you have type 1 diabetes, your body does not make insulin. Your immune system attacks and destroys the cells in your pancreas that make insulin. Type 1 diabetes is usually diagnosed in children and young adults, although it can appear at any age. People with type 1 diabetes need to take insulin every day to stay alive. If you have type 2 diabetes, your body does not make insulin or use insulin well. You can develop type 2 diabetes at any age, even during childhood. However, this type of diabetes occurs most often in middle-aged and older people. Type 2 is the most common type of diabetes. Gestational diabetes develops in some women when they are pregnant. Most of the time, this type of diabetes goes away after the baby is born. However, if you have gestational diabetes, you have a greater chance of developing type 2 diabetes later on in life. Sometimes diabetes diagnosed during pregnancy is actually type 2 diabetes. Less common types include monogenic diabetes, which is an inherited form of diabetes, and cystic fibrosis-related diabetes. How common is diabetes? As of January of 2022, this year, 37.3 million people in the United States, or 11.3% of the population, has diabetes. More than 1 in 4 of them didn't even know they have diabetes. Diabetes affects 1 in 4 people over the age of 65. About 90 to 95% of the cases in adults are type 2 diabetes. What health problems can people with diabetes develop? Over time, high blood glucose leads to problems such as heart disease, stroke, kidney disease, eye problems, dental disease, nerve damage, and foot problems. Now I'm going to tell you something. I'm a walking billboard for this. I was diagnosed with type 2 diabetes in 1999. Since then, I've had 2 heart attacks, 5 strokes, I'm stage 3 kidney disease, I'm blind in my left eye, I wear dentures upper and lower, I have peripheral neuropathy in my leg and both my hands and arms. I had my left foot amputated, and I'm a brittle diabetic. So these aren't just what ifs or maybes. This is the truth. Now here's seven signs to look out for, warning signs of type 2 diabetes. Number 1, frequent urination. If you find yourself going to the bathroom more often lately, there might be a reason. People with type 2 diabetes typically have excess glucose in their blood, which the kidney has to flush out and into urine. Then urine production increases, causing more frequent trips to the bathroom naturally. Number 2, increased thirst or dry mouth. High blood glucose levels can cause other related problems too. Frequent urination can lead to dehydration because the body has lost large amounts of fluids. As a result, it's common to experience dry mouth, increased thirst, the 2 signs of type 2 diabetes. Number 3, unexpected weight loss. Unexpected weight loss is another cause for concern. This may occur because your cells are not receiving enough glucose, or frequent urination could be contributing to the weight loss because you're excreting more calories and water. Persistent hunger. If you find yourself frequently hungry, you may have bigger problems than an expanded waistline. You may have developed insulin resistance, which means that your body is not using insulin properly in order to help glucose enter your cells. Compensate, your pancreas will increase its insulin production, which sends the message to your brain that you are hungry. Foot pain and numbness. High blood sugar over a prolonged period of time can cause diabetic neuropathy, like I just said. I have peripheral neuropathy, which can damage the nerves throughout your body. Numbness, tingling, or pain in the extremities will often follow. These symptoms are most common in people who have had the disease for 25 years or more. Not necessarily true. I got it after 10. Frequent infections are another common sign of the disease. Your elevated blood sugar levels give yeast and bacteria the opportunity to multiply more quickly, increasing your risk of developing problems such as feminine health issues and foot infection. Blurred vision. Short-term blurred vision is another one of the early warning signs of type 2 diabetes. It often occurs when there are rapid changes in blood sugar, either from low to high or from high to low. These are things to watch out for, my friends. Believe me, this is a vile, disgusting disease, and I wouldn't wish it on my worst enemy. There you have it. Please watch out for these signs. Please take care of yourself. I want to thank you for stopping by today, and I want to remind you, no one ever went blind by looking at things from the bright side. So look at things from the bright side. Give it a shot. And do yourself a favor. Do someone else a favor. Give them a reason to smile today. Hey, we'll talk to you again tomorrow. My name is Jimmy Apple. Have a good one, my friends.
Join Jimmy tomorrow for another apple fritter. In the meantime, stop over at our YouTube group page, Living with a Disability, join in the conversation and make some new friends. See you next time.